Break your waist and shake your waist. Your waist and shake your waist. Break your waist and shake your waist. Your waist and shake your waist. Break your waist and shake your waist. Your waist and shake your waist. Break your waist and shake your waist. Your waist and shake your waist. Break your waist and shake your waist. Your waist and shake your waist. Break your waist and shake your waist. Your waist and shake your waist. Break your waist and shake your waist. Your waist and shake your waist. Go down low, make you move and go down low. Baby, move on slow. Baby, baby. See, hello, my baby. Come to daddy. Don't be naughty. Just come and party. Move your body.
Hello and welcome to another edition of the Pepper Bird Magazine's production of Africa Teaching. I'm J. Rodney Chesson, your host. Tonight we are at the African Gala that is sponsored by Oasis International of Rhode Island. It's an annual event, and tonight we're fortunate to meet Dr. Michael Fine, who is the Director of Health of Rhode Island. Doc, hello and welcome to our program.
Thank you. Thank you. It's very nice to be here.
Yes. Doc, I know you've been dealing with this Ebola issue since it came about, and in Rhode Island we have a very large Liberian community. Tell us, what is Ebola?
Ebola is a viral disease, a virus, but it's a very dangerous virus. It kills 50 to 70% of the people who get it, sometimes even more. There have only been 10 outbreaks in history. The current outbreak in Liberia, Sierra Leone, and Guinea is the biggest outbreak and worst outbreak in history.
Wow. So when you say it has happened before, I mean, why hasn't it become so popular? Popular.
We don't know exactly. Usually, when it comes, what happens is it breaks out in isolated rural areas, and then kills basically everyone who lives in that isolated place. And then it doesn't travel because everyone who could have transmitted it has died. This time, it seems to be killing people just a tiny bit less, and it's broken out in a place where there are more people. And it broke out right in the area of Guinea that's close to Sierra Leone and close to Liberia. So it was able to get into these populated areas, and in these populated areas, it spread, and now it's spreading quite quickly.
Wow. So what can we do to prevent this thing? Because we know it's in Africa, and people are traveling every day to come to America. And our state in Rhode Island with the largest Liberian population, how can we secure it enough that this disease will not become infested in our community?
The best way to stop Ebola is to do what they did in Liberia, in Nigeria, which they stopped it in Nigeria by using good public health work, by identifying everyone who was sick and getting everyone who was sick into isolation so they couldn't spread it. The problem for Liberia is that there aren't enough health workers and there aren't enough resources. So the best way to stop the spread of Ebola in the United States is to get enough health workers to Liberia to get it stopped in Liberia. Now here is a different story. Here we have much better public health, many more health workers, and we think we could stop it if it comes. The good news is the only way you can get Ebola is if you're in contact with someone who's actively sick. If someone doesn't have symptoms, they can't spread the disease, and that's good news. So the only way to get Ebola in Rhode Island now is to be in contact with somebody who's sick, and somebody who's sick with Ebola is going to be somebody who has been in Liberia, Sierra Leone, or Guinea within the last 21 days, which is the incubation period. If somebody hasn't been in one of those three countries in the last 21 days, they don't have Ebola. Should someone come from Liberia, the important thing is if they get sick, and they've come in the last 21 days, they need to get to medical attention right away. That's the most important idea.
Now, we heard on the news recently that Liberians are complaining of being stigmatized in Rhode Island because of Ebola. Is this so, and what can we do to prevent this kind of thing?
Well, we are worried about that, but we haven't heard it specifically. We've been trying to meet every week with the Liberian community and listen out for that. From my perspective, the thing that we can and must do in order to prevent that kind of stigmatization is to be very clear when we talk about Ebola, that Ebola is a problem for all of us and all of us together. Remind everybody that we are one community of people and we take care of each other.
Thank you, Doc. Before we end this interview, are there any vaccines or anything you know about coming out right now?
Not right now. There's a vaccine that's going to start trials in December or January. We don't know how long it will take to prove whether it's safe and effective, and then we don't know how long it will take to be manufactured. I am very worried about West Africa, and very worried about the spread of Ebola in West Africa more than here. Here I think we can stop it, but in West Africa we have to get the resources we need to West Africa, and we need to do it now.
Okay, so let's itemize the resources now. One is what?
Well, we need Ebola treatment units for, my guess is 5,000 to 10,000 people. Remember, in West Africa altogether, we know about 10,000 people with disease, about 5,000 who have died, but everybody's best guess is that's an underestimate because of inaccurate reporting, particularly from the rural areas in Sierra Leone and in Liberia. So our real thought is there are probably 25,000 people who have Ebola, maybe 12,000 have already died. That's a frightening number, but the more frightening number is that the projection is that if we don't get 20,000 healthcare workers to Liberia soon, and if we don't get enough Ebola treatment units, and if we don't get enough supplies of food and water and personal protective equipment to keep the healthcare workers going, then by the middle of January, we're afraid we may see 500,000 or 1 million people infected, and half that many of deaths. The United States is building treatment centers, but we've got to do a better job recruiting healthcare workers to go to West Africa. And then we're working in Rhode Island with all our hospitals and trying to work with the Liberian community so people understand, should someone come from Liberia, we get them and they get sick, to get to the emergency room of a hospital right away.
Is there anything else they need to know?
I think that's most of it. The real important thing for people across the United States to do is to talk to senators and congressmen and make sure people know the urgent need for getting healthcare workers to West Africa now and in big numbers. Remember, when I was in Liberia in 2009, there were only 50 doctors for a population of 4.5 million and about 1,300 nurses. Some estimates suggest we need 20,000 healthcare workers in West Africa tomorrow. And we just have to do more to get the help people need to Liberia now.
I hear there are 1 or 2 companies working to recruit Liberians and other people to go back to Liberia in Georgia or something.
I haven't heard about that in particular. There are 2 organizations that are bringing healthcare workers to West Africa. Medicine Sans Frontiers, Doctors Without Borders is one, and the International Medical Corps is another. But we need to make a national commitment as the United States of America to support and send volunteers to get to West Africa as soon as we can get them there. That's the way to get this stopped.
Thank you very much, Doc.
Thank
So
you.
I hope the Liberian community has been working with you.
We have been working together. It's a phenomenal community. The Liberian community has some young people who I think are the best in the world.
Thank you very much, Doc. Thanks
you.
for this interview.
Thank you for taking the time to talk to me.
Thank you, Doc. Thank you, ladies and gentlemen. This has been Pepper Bird Magazine with special report for you. Thank you.
Fifty percent.
50%.
50%. Did you know that if you're between the ages of 18 and 35, you're 10 times more likely to die from a car crash?
Increase your odds by 50%.
Just by wearing a seatbelt.
It can make the difference between living or dying.
I know this.
We know this.
Do you?
So click it. Red ticket. In Rhode Island, it's the law. Seatbelts save lives.
Break your waist and shake your waist. Your waist and shake your waist. Break your waist and shake your waist. Your waist and shake your waist. Break your waist and shake your waist. Your waist and shake your waist. Break your waist and shake your waist. Your waist and shake your waist. Break your waist and shake your waist. Your waist and shake your waist. Break your waist and shake your waist. Your waist and shake your waist. Break your waist and shake your waist. Your waist and shake your waist. Go down low, make you move and go down low. Baby, move and slow. Baby, baby. Sleep over, baby. Come to daddy. Don't be naughty. Just come and party. Move your body. Oh, my baby. Shake your waist and shake your waist.